Awesome. Thank you so much for the wonderful introduction for Every Dog Behavior and Training. I think that this is an incredible organization, and I'm just really excited and happy to be here today. Yeah, so to introduce myself, my name is Valli Parthasarathy. I have a PhD and a vet degree and a board certified veterinary behavior certification. I've been studying dogs for a very, very long time. I have a I have a referral practice called Synergy Veterinary Behavior in Portland, Oregon. And through our practice, I see dogs, cats, birds, horses, any species that people want behavioral help with. I am happy to see them. So it's a treat for me to talk with people about just the different behavioral concerns that are out there. And today I want to focus, of course, on cognitive dysfunction and talk a little bit about what cognitive dysfunction is, and is it cognitive dysfunction or could it be something else? And delve into that a little bit. So, cognitive dysfunction itself, of course, is a topic that can span many, many hours of discussion. So I'm kind of touching on the surface of this condition. Um, but certainly if anybody wants to delve in a little bit more, talk a little bit more about it, I'm happy to do that in the chat afterwards, or separately. So when, as aging occurs, what we know is going on is that companion animals are living longer. Um, According to a resource or a summary, excuse me, a survey that was done back in 2022, at that time, about 52% of households, which was at that time roughly about 26.5 million households in the US, have older dogs. So these are dogs that are over than 7 years of age. So, our companion animals are living longer, so more and more people have them. So as pet guardians, as veterinarians, as animal trainers, we are going to be seeing these animals more and more as time goes on. And also as people become more aware of normal and abnormal behaviors, and we'll talk a little bit about that too. But as people become more aware of it, they're going to come looking and asking us for help. The American Animal Medical Hospital Association, or AHA, defines senior in dogs as the last 25 years, or 25% of estimated lifespan through the end of life. And the reason for why there's variation like that, why they have it as a percentage, is because the lifespan of these different dogs vary based on their size. Is one of the biggest contributing factors. So, for example, we know that the giant breed dogs like Great Danes are going to have typically a shorter lifespan than some of the really small dogs that might live up to 15, 18, 20 years of age. So to be able to try to make that a little bit more cohesive, they suggested let's let it be the last 25% of the estimated lifespan through the end of life for as best as we can for these dogs. For cats, since cats are pretty similar across the board by and large, with cats, they are thought of to be senior when they're above 10 years of age. And cats, as you might know, oftentimes live into their 20s. Yep, I'm having a little bit, there we go, a little bit of a computer issue. There we go. But as we go on, and then so I talked a little bit about why this is important, but the other reason why I think that this particular presentation is important is because these are some of the things that I heard of when I was in general practice. I would hear that people would say, their dog's getting kind of old and maybe they're slowing down, or this type of behavior. It's normal for old dogs and cats to slow down and sleep a whole lot. It's normal for them to hide a lot. It's normal for them not to go on to walks anymore. It's normal for them to have the occasional accident. Maybe they even said, I think my dog is upset with me. And a lot of times people have these dogs and these cats for many, many years. So sometimes they've had them as kittens and have lived with them throughout their entire lives. And now they're like, well, now they're doing these behaviors and he's peeing on the rug and he must be upset with me for some reason. Sometimes people say that they seem confused, or there maybe are some other behavioral changes that have occurred that are concerning to them. And sometimes the first time we hear that there's a problem in the veterinary and sometimes also in the training world, the behavior world, is that they're coming to us for a euthanasia appointment or sometimes for a euthanasia consult to try to figure out why this pet is having these behaviors. And so, aging itself is not a disease. Aging is a natural process. However, aging does predispose the body for other medical conditions as the complex systems that are made up to keep the body healthy start to not work quite as well as they used to. So when we have the senior dog or the senior cat in front of us, and we're seeing some maybe unusual behaviors or behaviors that are concerning for the client, one of the things that we need to think about is this a medical issue that's going on? Is this a behavioral issue, or could it be both? And I would say in my line of work, most of the times it is both. And when I'm talking about the majority of the research, the majority of work that's out there has been done on dogs. There is some research that's been done on cats. But when I do mention if I do have a slide like this that mentions dogs, I don't want the cat people to feel like they're being left out. This is the same for cats as well. So let's talk about cognitive dysfunction, because cognitive dysfunction is sort of the hallmark behavior concern that people think about when they have a pet who's maybe acting a little bit odd, maybe acting like they're more disoriented, or they don't seem to be able to understand things that they used to understand, or they seem to be forgetful about things, or maybe there's something else that's happening. But oftentimes clients are like, oh, well, this is related to old age. He must be getting senile or must be having some dementia. So I wanted to talk a little bit about cognitive dysfunction as far as what its presentation is like, its prevalence, talk a little bit about treatment options, and then some of the aspects of behavior modification that would kind of fall under the treatments for it. I also want to talk about, as far as before treatment options, is I'm going to talk also a little bit about what are the other things it could be. What are the medical conditions that we have to keep in mind as we are looking at these patients? So cognitive dysfunction, the way I think about it is something that's progressive. It's something that's irreversible. So if a dog or a cat has cognitive dysfunction, we know that it's something that's going to be there. It's going to be there for the rest of their life. So we do know that if there is some sort of treatment that we want to use to help modify this behavior, and if we find that it works and that it's helpful, this is something that we're going to need to continue for the rest of this patient's life, because the cognitive dysfunction doesn't go away. It's characterized by cognitive change and impairment. And so by cognitive change, things like problem solving, spatial awareness, sometimes their time change, their ability to be able to assess time. Those are all things that fall within the cognitive realm of behavior. And so we have these changes that are cognitive, and then this change is associated with degenerative changes in the brain, which I'll go into a little bit more. And from a from a sort of a cellular standpoint, in dogs especially, what we see in dogs is very similar to what's seen in Alzheimer's disease in people. One of my favorite tools for screens for cognitive dysfunction, there are several, but this is one which I feel is really easy to understand, easy to give out. This is one that, if you're a veterinarian, you can send it to have clients take home. You can have clients fill it out in the waiting room. For trainers, you can absolutely access this and give it out to your clients as well, and have them fill it out and take it to their veterinarians. So this is something that's a very easy access type tool, and it's called DISHA, and DISHA stands for different aspects of behavioral change, or different basically components of behavioral change you might see. So disorientation is one. With disorientation, that's kind of what I was talking about before, where maybe the dog, so some signs that have come up in my practice have been maybe the dog goes outside and then doesn't seem to understand where they are, or they've been using the same dog door for years, but then just can't seem to figure out how to go out the dog door, or they've been going out the back door for years and the hinge is on the left side, so the door swings open on the right side, but the dog keeps going to the wrong side when always they used to go to the correct side. Sometimes they get stuck behind furniture, like they go behind furniture and they can't figure out how to get themselves out. Sometimes these dogs, and this is a really interesting one because I've had several dogs who'll go into a small room like a bathroom or a closet and then somehow shut the door behind them and then get themselves stuck and then panic that they're stuck. So so those are all ones that sort of fit in sort of the disorientation. You might have some more anxiety. So anxiety can be that they're just a little bit more anxious in general, they're a little bit more on edge. Sometimes they start developing new anxieties. Sometimes we start developing separation anxiety, sometimes sound phobias, certain other anxieties. So anxiety may be a potential hallmark of that as well. Activity, some of their activity may change. It might be higher than lower. It might be lower than before. You can have house soiling. That's the H part of the DISHA. Um, so you can have house soiling, learning, and memory. So maybe we are losing our house training. Maybe we're eliminating at times that are kind of unusual. Maybe we don't remember things that we used to very well. With social interactions is kind of the I part of DISHA. Interactions might change. You might have dogs or cats who maybe were very social, but now are not. Or you have cats that and dogs that maybe tended to be a little bit by themselves, but now they're really, really clingy. So these are all signs as well. And then changes in the sleep-wake cycle. Um, that is something also that we commonly see. And that's one of the big ones that comes to me as well, because we have patients whose maybe they're the clients whose patients are keeping them up all night, and they're not getting any sleep. In behavior, we say that it's very rare that we have a true behavior emergency because most of the time, behavioral conditions gradually build up over time. But when people are not able to sleep at night, I do see that as a behavioral emergency, and we try to get them in sooner rather than later, because with sleep deprivation, that's a really significant welfare concern for both the people as well as the pet. So these are some of the main sort of categories of behaviors that we might see. And I have the link here for the Purina Institute. They have a sort of 3-page screening of it, which is kind of nice because you can go through, you can take a look at it, you can you can add in the numbers and see whether your pet likely is to have a high, medium, or low chance of having cognitive dysfunction. And this is something then you can, like I said, for veterinarians, this is a great screen to do. And I would do this early. I would start screening your pets at 7 years age and go upwards. Start early so that because the best value in any of the cognitive dysfunction scores are scoring systems is to look at the change over time, because then we can see is something progressing where it wasn't before. So as far as some of the research that's gone, what we do know, where in studies that have looked at various cognitive tasks, we do know that puppies, young adults, and adults tend to perform better than the mature, old, or senior dogs. So these are dogs that are getting into their, eights, teens, higher than that. Um, and we can see the little star means there's significant differences. So the mature, old, and senior groups are significantly greater than the adult and the young. And then as you get even older, you see the puppies are a little bit higher because the puppies haven't learned quite so much. You can see that they're also significantly different from puppies as well. So basically what this is saying is that this, for as far as visuospatial function, but we do see this in other cognitive abilities as well, that cognitive ability tends to decrease as age decreases. We also see that the number of clinical cognitive dysfunction signs tend to increase as age increases. So, for example, this was a screen done where they had kind of two groups of dogs. We had dogs who were 11 to 12 years old and 15 to 16 years old. And they had either one or more category of behavioral concern associated with cognitive change, or two or more categories. And so what we could see is that from the 11 to 12 years old, um, they had 28% to 68%. And then as they, oh, sorry, I think I actually did this in the wrong direction. My apologies. So what this was supposed to be was the 28% here and then 10% down here. So what it was supposed to be that 28% of the 11 and 12 years old had one category, 10% had two or more. When we got up to the 16 15.5%, or the 15 to 16-year-olds, it was actually 68% were having one or more category, and then 35% were having two or more. So what that's saying is that, and yes, it's more than 100, because we had some that had two, which would fall into both. But basically what this is showing is that when you have one or more, that the age, you're going to have more of one or more category, but then also the prevalence of having many more categories also increases significantly as we have age as well. So then here, this was more of a longitudinal study of senior dogs who were showing some cognitive signs over a span of 12 to 18 months. So they weren't 12 to 18 months old. This is a span of senior dogs over 12 to 18 months old. And what they showed that 48% of dogs who started off with only having one sign of cognitive dysfunction, by the time about a year to a year and a half later, they were showing two or more signs. And then 22% of dogs who were showing no signs at the start of this, by the time a year and a half later, they were showing one sign at least. So again, this is something that is progressive. And so it's not just that it's occurring at a certain age as they're older, but there's also, as each individual ages, the age is progressing within the age of that animal as well. Now, the part which I find, interesting, but a little bit sad as well, is that we think that cognitive dysfunction is prevalent in about 14% or so of dogs. But really, as diagnosed by veterinarians, it's only about less than 2% of the time. And this is a cross-sectional study of older companion dogs. And that means, what that says to me is that there are about 12% of dogs or so out there, that's a lot of dogs, that are suffering from cognitive decline or cognitive change, and they're not getting any help. And sometimes that's because clients don't recognize it. Sometimes they're not asked the right questions. Sometimes there's the misconception that it's normal for dogs to act this way and there's nothing that can be done. And what I just want to tell you is that often there is a lot to be done. So there are things that we can do to help these dogs, even if they're starting to show some pretty significant signs. There are things that we can do to help them in a lot of cases, not every case, but in a lot of cases. With cognitive dysfunction syndrome in cats, two of the big things that are seen are vocalization and also decreased grooming. Looking at our cross-sectional study again, looking at cats, when they looked at 11 to 14-year-old cats, about a quarter of them had at least one sign of cognitive change that was occurring. And like the dogs, a lot of those same sort of Disha type signs are there in cats as well. And the vocalization and decreased grooming were two big components that they tended to show. And then with 15-year-old cats, at least 50% are showing some of these signs. So, and we know that there are a fair number of 15-year-old cats out there. So again, from a veterinarian standpoint, start screening early. Start thinking about and having clients think about where their cats mental state is. For those of you who might be working with cats in a training capacity, older cats absolutely can learn things. There's no such thing as, they talk about dogs being too old to learn tricks. No, you can teach an old dog new tricks. You can also teach an old cat new tricks. So you can absolutely help with treatment of these cats even when they are older. So thinking about the biological basis of cognitive dysfunction, for dogs especially, again, more work has been done with dogs and cats on this, but here's a couple of images of a 2-year-old dog and then a 15-year-old dog who is showing some cognitive change. So you can see just in general, they have we see a decreased number of neurons. Some obvious things that you can see on the screen here, you have these ventricles, which are these liquid-filled areas in the brain that are involved with bringing, proteins, nutrients, everything like that into and out of the brain. They are more dilated in the older dog compared to the younger dog. We also see that the cortex, which is where a lot of information is stored, that's we were saying we're having some cortical atrophy there. You see, it's not as thick. And the reason for why we think that this is happening is that we think that there's oxidative stress that's due to free radical formation. So we know that free radicals um, can cause um, issues with energy flow and energy production. And so as we're having this disruption, we start having changes in the brain. And so these oxidative stress, what it can lead to are what's called beta amyloid plaques. And these plaques are these abnormal clumps of proteins that build up between the nerve cells in the brain. And so these cells are dying, they're clumping together. There are these proteins called tau proteins that are part of it. And so they all kind of clump together and form these plaques. And these plaques are seen in dogs with this issue. And then we're also seen in humans that have Alzheimer's disease. So we do know that there is a physical component to cognitive change. Um, so there is something medical going on. The thing to keep in mind is that the clinical signs of cognitive dysfunction, a lot of the ones that I talked to you about, the thing is, they look like a whole lot of different other things. So these signs are really non-specific. And so we kind of get into this issue of, okay, well, how do we know whether or not this is cognitive dysfunction versus some other medical condition that could be going on? And the thing that I would say to you is that cognitive dysfunction oftentimes is considered a diagnosis of exclusion. Um, I I think that as an idea, I think that's important to keep an eye on. However, I do also think that it's not something that is it's not something that's separated. So, for example, if I have a patient who comes to me and I'm suspecting that this dog has pain, I'm not going to, or I think that this dog needs to have lab work, or this dog has some other condition. I'm not going to say, hey, I'm going to withhold behavioral treatment until you get this looked at. I'm going to provide behavioral treatment as well. So what we need to think about is that oftentimes these pets have multiple conditions going on, and we need to treat those concurrently. Um, so common medical conditions that can occur in dogs and cats. Um, Big ones that I want you all to keep in mind: pain. Pain is a huge one, and many dogs and cats in particular are really, really good at hiding pain. Um, Pain can, so dogs and cats don't need to cry out when they're painful. A lot of times cats don't show a whole lot of lameness because a lot of times, especially arthritic degeneration in cats, oftentimes is bilateral. So oftentimes they're not limping because of that. Um, and so you can have endocrine disorders, you can have infectious disease, you can have neoplasias or cancers, you can have inflammatory processes. There's a whole slew, which in my veterinary talks I go into that in more detail. But there are a lot of different medical conditions that can be playing a role in this. And how we start teasing this apart is through diagnostics like blood work, um, radiographs, ultrasounds, trying to figure out there's a biological, or excuse me, a body component to these behavioral changes that we're seeing, or is it a brain component? Now, I've lifted up some examples of things that I've seen come through my practice of dogs that were showing, and some cats who were showing some of these different signs, and they came to me because they thought maybe they had some cognitive dysfunction. And what we found was a big contributing factor. So, for example, I've had several patients who've come to me, dogs especially, that are showing nighttime restlessness. And what that usually looks like for these dogs, it's oftentimes they are starting to get restless as their people are getting ready for bed. They might be getting them up at 2 or 3 in the morning, panting, whining, walking around. They just can't settle. And oftentimes pain is a huge factor in that. So if I have a patient who's come in that has not had any sort of pain trialing or pain diagnostics, that's one of the things that I reach for, especially if I see them in the clinic and I see that they're very stiff or having difficulty moving. Um, I've had cats who've come for urination in the house. Typically, so I've had a couple where it's been an endocrine disorder. I will say that typically, most of my cat patients, most of the veterinarians that refer to me, they're awesome at getting blood work on these cats. So most of these cats where they're urinating for an endocrine disorder don't get to me. But that is something that I wanted to make sure that everybody knew, is that urination in the house, it could be absolutely something physical, and it's not necessarily a urinary tract infection. It could be an endocrine disorder. It could be, for cats, feline inflammatory cystitis. You can have urination in the house because maybe and I had one cat like this where they were painful when they were trying to position to eliminate. And when that pain was resolved, the cat was going back into the box. Same with dogs. I had one patient that it was actually really interesting because there were two dogs in the house. Actually, I think there were more, but there were two in question. And the client thought that one of them was eliminating in the house. When we set up a video, it turned out that the other dog was eliminating in a house. And the reason why was because the dog was so arthritic and sore that they couldn't make it out the dog door. So the dog was eliminating right beside the dog door. And the client came to me and was like, I can't figure out why my dog's not using the dog door. And it turned out to be the other dog, not the one that they brought to me. So you can get some very unusual sometimes or unexpected presentations. And when you do have multiple pets, this is just a plug to please, if you have multiple pets in the house, please encourage video so that we can confirm who is actually doing what we think is going on. So sudden separation distress. I've had one client where, again, there was a pain component for this dog. Noise phobia. So hearing decline. I had for one of my own dogs, as he started to lose his hearing, he started to not hear lower pitches as well. And this dog never had a problem with fireworks. The year he started losing his hearing, all of a sudden, when there were sort of the lower booms in the distance, that didn't seem to make a difference for him. But then when the higher pitched swirly noises or swirly fireworks came up, the ones that whistle and are really, really loud, those ones, even when they were quieter in the distance, those ones he heard and he started to act scared. And I think because for him, he wasn't hearing all the other stuff, so this all of a sudden was coming in that he was perceiving. So hearing change can relate to noise phobia. And this is, of course, changes in senses is something that we're going to see in older dogs. They're going to be losing their hearing. They're going to be losing their vision. The other big thing when we have dogs who are noise phobic, especially dogs where maybe they weren't as a younger dog and they're starting to become as a middle-aged or older dog, orthopedic and neurologic pain can be associated with increased noise phobia, as well as in my clinic, I've also seen gastrointestinal pain. So just be aware that there are so many different modalities that could impact this one sort of one behavioral clinical sign. Decreased appetite. So I had one patient who came in where the client was like, well, he's getting really old and I think he's forgetting where his food is. And I was like, okay, well, that's kind of an unusual one. And so as I asked a little bit more, they turned out that the dog was going to the food and kind of like looking at it, staring at it, and then would walk away. So I was like, okay, well, the dog obviously knows where the food is, and it's pretty unusual for a dog to forget how to eat. So what else is going on? So as we delved into a little bit more, and it turned out that this dog was having some intermittent diarrhea and some other, gurgly tummy, things like that. And it turned out that we did some testing and this dog had inflammatory bowel disease. That became more prevalent as this dog grew older. So you can have these changes that can occur. Sometimes these are conditions that are present when they're younger, but then just as they get older, they just can't compensate for it as much anymore. The other thing to consider is, are there any concurrent behavioral fears that are occurring? Because I think about, well, all right, is this dog or cat having to go to the vet more frequently because maybe they do have some sort of concurrent medical condition and they have to go to the vet more often to get blood work done. So are we having an increase in veterinary fear? Are we having a fear of being handled or brushed? If I have a patient coming in who has a fear of being handled or fear of being brushed or fear of being touched by their own people, pain is one of my rule outs for that. But then we also think about, okay, yes, maybe we're having some of these other cognitive signs that we're talking about, but we also have to remember that we have to address these as well. And talking with the clients and figuring out, okay, what and where are the priorities of what we're going to do? Because even if we treat the cognitive dysfunction and we help that, that's not necessarily going to help with these. So these sometimes have to be addressed separately. Are there new fears or phobias that have occurred? Is there an increasing fear of new people or animals, like unfamiliar people or animals that wasn't there before? Are they hiding more rather than they were before? So trying to, and we do know that hiding is one of the, one of the signs that an animal might be sick, but sometimes it could be a sign because they're fearful. So thinking about, starting to sort of tease some of these apart. And so that's a lot of what I do in my consults is trying to figure out to what extent, as best as I can, to what extent is there a physical component? To what consent is, what percent or what context do we have of a behavioral condition and what part is being played by potential cognitive decline? So for treatment, treat what you know is there. So if you are a veterinarian and you have done blood work on this and you've done a physical exam on this dog or cat, or you've done blood work on this dog or cat, and you know that there's pain or there's an endocrine disorder, go ahead and treat those. Because making those any sort of underlying behavioral or any underlying medical condition more stable is absolutely going to help behavior. For um, cognitive dysfunction specifically, there are various pharmaceutical, nutraceutical, and behavioral things that we can do to help. So I'll jump into those in just a second. So to think about sort of what are the big things that are out there sort of commercially to help with cognitive dysfunction. The big medicine that was FDA approved is called Anapril, and I'll show a picture of that in a minute. It's a monoamine oxidase inhibitor, and I snagged this photo from a video actually of a place called Animated Biology, which I thought did a nice job in just generally explaining what these do. So monoamine oxidase is an enzyme that's in the cells in the brain. And what happens is that neurotransmitters such as dopamine, serotonin, norepinephrine, neurotransmitters that are involved with mood and cognition get released and then bind to receptors on the other side of this little junction, the presynaptic junction. They bind to that and the signal continues onwards. After they've done their job, they get brought back into the cell and then they get broken down by the monoamine oxidase and then repackaged and then used again. So they get broken down. And so what that does is that reduces the amount of active neurotransmitter that's in this area. So what the monoamine inhibitor does is it blocks the ability of this enzyme to break down these neurotransmitters. So that results in more of the norepinephrine, dopamine, and serotonin being in these neurotransmitter junctions, which then help with mood and help with general cognition. So Anapril is a medication that was FDA approved for this particular problem. I believe that Zoetis may be discontinuing it, unfortunately, but there still is the generic version that is available. I've had hit and miss luck with selegiline. I've had some patients where it has absolutely made a huge difference. And what I mean by huge difference is that we've had, so if this is the dog when it was normal, and we've had progression of this dog to where it is no longer, where it's no longer, having normal function, the solution was able to get it back, maybe, 75% improvement. So, which is huge for clients where maybe this is a component of the dog not sleeping at night, or maybe this is a component of the dog being confused. This is huge because people are like, you know what? It's almost like I have my dog back again. Now, the thing to keep in mind with any of these is that this is going to be a progressive disease. So this is not so it's going to progress again. And at some point, this is not going to help, but it can be very, very beneficial for many patients. There's also a product which is a supplement called Senilife. It has some antioxidants in it. It has a phospholipid that's associated with neural membrane fluidity. It helps promote that. It has some vitamins to help with neurotransmitter synthesis of neurotransmitters, especially including serotonin. Remember, serotonin is really helpful for mood. So these help from a supplemental standpoint. I've had some patients respond as soon as about a week or two on this. So oftentimes, especially if I have a patient on another medication, or if I have a patient that perhaps we have something going on with an organ and I'm not sure whether I want to start them on an actual medication, I might start them with a supplement like this and see, in a couple of weeks, do we see any sort of differences? And for some patients, it makes a big difference. And some patients it doesn't. So but it's worth keeping an eye on. And then there's SAMe, adenosine, which I can't really say very smoothly. Um, but this is a product this is a component that stabilizes cell membranes and may slow that neurodegeneration that I was telling you about. The cells kind of breaking apart and clumping together. It may help slow that. Um, and this is actually something that we see in some of the liver protecting products as well. So Denamarin is one of the products that has that, and so that might be an alternative for some patients as well. Sometimes we also use pharmaceutical adjunct medications, and that can be to help with perhaps things like that the base medication maybe doesn't help as much. So, or if we need additional calming. So, for example, for a lot of my dogs that come to me that have nighttime restlessness, I'll often add a benzodiazepines. The benzodiazepines are the medications like Valium, Xanax. Um, they're the medications that are very good, like calming medications when they work well, for the patients who respond well to them. So the benzodiazepines can be very good for helping these dogs be calmer. And for some dogs, they need that in addition to the base medication that they have. Gabapentin is one that I often use, especially if I have a dog who comes to me where I suspect there may be a pain component. Gabapentin is very helpful for managing pain that many of you probably know, but it also helps decrease anxiety for many, many dogs. So it can be very helpful as an adjunct to a base medication. Trazodone as well can be very helpful adjunct to a base medication, and trazodone also impacts serotonin in a slightly different way than these other base medications that like selegiline. Um, but these are quick acting medications that take effect in a couple of hours, an hour to a couple of hours, depending on the medication. So if we need situational help, like at night, or if we have a dog who has become more fireworks phobic as they've grown older, these are some options as well. There are also other supplements that I might use as an adjunct. So L-theanine, for example, can help with GABA synthesis. GABA is a neurotransmitter which is very helpful for calming. L-tryptophan is a precursor for serotonin, and again, serotonin helps boost mood. Alpha-casozepine is a milk hydrolyzed protein, which has been shown to be helpful in promoting calm behaviors in dogs and cats. Zilkene is one of the products that's out there and available. And so all of these are ones that I've used in some capacity or another with many of my patients, and some of them in my cognitive patients as well. So again, if I have maybe a patient who has significant liver involvement or significant kidney disease, I might reach for one of these supplements rather than one of the base medications. The other thing to consider for cognitive dysfunction, there are some diets that are out there. So Purina NeuroCare has some medium chain triglycerides and omega-3 fatty acids. Those are all neuroprotectant, which is really helpful as well. Purina Bright Minds has a slightly lower concentration medium chain triglycerides. For some clients, it has been helpful. It's a little bit less expensive than the NeuroCare. We don't quite have the same concentration, but for some clients, it can be helpful as well. So if you have a dog who doesn't have a food sensitivity, one of these could be very helpful as a supplement, for a supplement as well. And there are some patients that respond really well to just this. The thing that we have to keep in mind is that for this, and as well as the selegiline, they can take a couple of months to really build up in the system. So it's really important to try to get a hold on this and start investigating this sooner rather than later, because, if we're trying to do these and we have to do a couple of months of trialing for a medication, say, then that's going to be time that this dog's condition may be continuing to progress. So then talking about sort of the behavior modification side of things, or what else can we do? And this is what I recommend to all of my patients, regardless of whether or not there are medical conditions going on. So behavior modification, one of the things I want to focus on is the relationship. And the reason for that is because oftentimes and I see a lot of the serious cases, right? So the people who haven't been sleeping, the dogs who maybe have been starting to urinate all over the house, the dogs who are just acting off in ways that are really unpredictable, let's say. So oftentimes by the time they get to me, the relationship between the dog and the person is really strained. So one of the things I want to do is seeing, okay, what can we do to rebuild that relationship? So the first thing that we just advise clients to do is to avoid any verbal or physical corrections. We want to avoid scolding. We want to avoid reprimands, leash corrections. We also want to avoid any sort of physical manipulation like alpha rolls or muzzle grabs. This is mainly dogs. Talk about cats in a minute. But the reason for all of this is any sort of verbal correction, which is also important for cats, verbal and physical corrections, um, scolding and reprimands, that's going to increase the stress that the animal feels between you and them. So that's just going to increase their anxiety associated with your presence. And that's not going to help whatever it is that they are going through. Physical manipulation, so alpha rolls, muzzle grabs, grabbing a cat, scruffing it, holding a cat down, any of those are going to be physical manipulations. And that can be, if you think about it, remember, a lot of these animals, they're seniors, a lot of them have arthritis or other pains. And so, and doing anything like this can be very painful for them also. And that's not going to help your relationship either. Oh, one thing also I want to say with anything that could be a threat. So for example, for cats, a lot of cats, there are some cats that love the squirt bottle, but there are a lot of cats who don't like the squirt bottle. And then people will say, oh yeah, I show the squirt bottle, my cat runs away. We want to try to avoid showing things or displaying things that they can see as a threat, because again, that's going to make them tense up and run, and that could cause also them to be painful. We also want to reinforce desired behaviors, and the thing that's important to keep in mind is, figuring out what those desired behaviors are. So for one client it might be, you know maybe the dog is pacing, so maybe we can reinforce some calm behavior, or maybe the dog is house soiling, so maybe we need to go back and do some remedial house training behaviors. And remember that it's not necessarily going to resolve the clinical signs, but hopefully it'll help reduce them a little bit. And also the other thing is, if you're working from like a client's perspective, that it gives them something that's positive to work on with this dog. I also like giving them ideas for enrichment. So depending on the dog and depending on their health, I might look at food puzzle toys for them. I might look at toys where they're chewing. I might look at other forms of enrichment, like, food enrichment. Maybe they're a dog who likes to have different textures in their food. Maybe social enrichment. If we have a dog or a cat who's a real social butterfly, maybe we can go ahead and, have them come over. Or sometimes you may have seen on, various YouTube videos or on social media about people who will take their elderly dog out in a stroller or on a wagon so they can get out and do things and have that enrichment. Sometimes physical enrichment can be helpful as well. By physical enrichment, I mean, are there things that can be brought in to be interesting for them? So, I was reading one, every now and again, I hear stories about people whose dog wasn't able to go on walks, so they pulled up pieces of grass around the walk that they would usually go on, and bring the dog grass back, and then the dog would sniff the grass. Um, and then, similarly for cats, maybe wheatgrass, things like that, that they can chew on and sniff on. Um, Keep in mind that if there's a dog who hasn't really done this sort of enrichment before, they may need to learn how to do it. And then teaching them tricks for dogs or cats can also be a great way to both enrich them, but then also to really help bond that relationship. The reason why I really like tricks is because there's less expectation, I think, on tricks. Like if you have a goal, like working on house training or working on relaxation, if you're working on just that all the time, I think it can get really tiring. And also that can just be, then I think it's easy to lose sight of the pet being your companion and being fun. So having things that you can do that are fun and engaging and enriching, I think is really important. And then promoting also just calm social interactions is a great thing. Um, Exercise can be useful for some dogs. I would say that the exercise that you do should be age appropriate and health appropriate. So, for example, I would not be recommending that the 14-year-old dachshund be running up and down the stairs, because that could be pretty hard on their back and they probably have arthritis. And we don't want secondary inflammatory, or excuse me, intervertebral disc disease to crop up when we're doing that. Um, but, maybe a slow walk around the block might be an option for that dog. Also, just keep in mind if you have increased anxiety in general, thinking about whether or not exercise is appropriate or not. Does it actually help calm the dog, or does it make the dog more amped? So sometimes exercise actually needs to be reduced in certain cases. Oftentimes, I'll recommend doing enrichment during the day and in the late evening, especially for dogs who are having nighttime restlessness or cats who have nighttime restlessness. For cats, there's a certain amount of normal nighttime restlessness that goes on that's sort of normal to them as a species. So there's a certain amount of that that's not cognitive. Um, but you can do things like set up dishes for them where they have to kind of hunt for them, sort of expend a little bit of some of that energy that way. Again, it may not get rid of the nighttime restlessness, but in conjunction with some of the other things that we talked about, it should be helpful. And then desensitization and counter conditioning, to some of these other things that we talked about. So, I mentioned before that maybe these dogs or cats now are starting to get worried about going to the vet, or they are, maybe they're afraid now about certain things that they weren't afraid of before. So we can start now from a training standpoint. So for those of you who are professionals in behavior modification, this is now something that you can start working on as well with these patients, and figuring out, okay, how do we teach them to be more comfortable about being handled? What are the positions that are going to be comfortable for them? What are the things that they feel like they like? Are there areas they're more sensitive that we need to be aware of, so that we can make sure that what it is that we touch is actually going to be something that's going to be comfortable and within their comfort level as we're starting this out. And so desensitization and counter conditioning just is exposing the animal to whatever the fear provoking or excitement, but usually fear, emotion provoking stimulus, but in a way that does not trigger a fear or stress response. So if we have a cat, for example, who, when the vet reaches for them, they back up and hiss, then maybe we start with someone who's not the vet, who the cat's comfortable with, doing a little bit of a reaching motion, and then the cat gets a treat or gets pets or something that the cat really likes. And then they reach a little bit more and then reach a little bit more until finally they reach for the cat's head. And then maybe we move it to somebody who the cat doesn't know but is not the vet. So then we do the same thing. We start with a little reaching movement, and the cat gets a bunch of treats. A little bit more, and the cat gets a bunch of treats, and then a little bit more, and so on until the cat's like, oh, okay, I have a whole bunch of people who are reaching for me, and then it's okay. And then maybe we do some separate training at the vet's office where we can get them. And yes, I know some cats don't like going to the vet's office at all, and that's a whole different aspect of training. But I'm saying, let's say the cat's okay going to the vet. But maybe then we start off with one of the technicians doing this, and then working up to the veterinarian, and then working up to maybe other aspects of it. So that's what desensitization and counter conditioning is. It's slow, it's structured. They always say in the various, I always hear in the various conferences, good desensitization and counter conditioning is like watching paint dry. It's not exciting, but if you're in the middle of it and you're seeing it, you're thrilled. There is some research that was recently published, which is really kind of cool. It was a class that was run for dogs who are at least 8 years of age. And what they looked at was whether or not that seemed to help the development and progression, or make any impact on the development or progression of signs of cognitive dysfunction syndrome in dogs. And so in this particular class, they did show that it may potentially slow the progression of cognitive signs. They had a control group of dogs who did not go to the class, and they found that the dogs who did go to class, any cognitive signs that they had tended to be not very progressed, whereas the dogs that didn't go to class, their cognitive signs had progressed quite a bit. So there may be some protective aspects of going into that class. Now, things that you can think about for a senior dog class, things that could be beneficial, depending on the class and how it's run, is that you can have information about the health. You have another set of eyes that's on your dog regularly. And, a person who is a dog trainer has seen probably hundreds of dogs and might be able to say, oh, your dog is moving a little bit differently. You should get that checked out by your primary vet. But having another set of eyes is really helpful. Like I was saying, there could be information about health, either that somebody, like, reputable sources that they give information from, or maybe there's someone, a health professional that's in there teaching the class, or assisting in the class. Age appropriate interactions. So that might mean that you're watching the other dogs from across the room. It doesn't necessarily mean that you're having play groups. If you have a bunch of old arthritic dogs there, they may just want to watch each other, or maybe just sniff a little bit, if they're appropriate for that. There can be enrichment. So maybe introducing them to different types of interactive toys and figuring out what is this type of toy that Bowser really likes? What's the type of toy that Fluffy really likes? And figuring out, what is it that these dogs at this age really enjoy? Because one of the things that we have to remember is that puppies, a lot of times these dogs, when they were puppies, they were often given a lot of enrichment. And then as we go and they get a little bit older, and I'm guilty of this as well. I don't put as much effort into my enrichment because they're doing their own thing. They're figuring out their own enrichment. But I'll tell you that senior dogs, when you bring out those stuffed interactive toys, or you bring the things that they used to play with as a puppy, oftentimes their eyes light up. They're really excited about it. So bring those things back for them. And then, of course, going to a class promotes a little bit of exercise. They have to walk into class, they have to walk out of class. And again, it might slow the signs of cognitive decline, which can be, of course, the goal of this. So some take homes that I had for veterinarians is to start screening early. Start screening them when they're 7, 8 years old, and just ask them when they're coming in for their annual or biannual exam, or every 6 months exam. Ask them how ask them what's on the screen, and just have whichever screen that you pick, go ahead and have it just be consistent so that you can have a comparison over time. Keep in mind that the cognitive change that you might see, or the cognitive change that might be reported, it may be purely a cognitive dysfunction thing. Most often, if it is cognitive dysfunction, it's going to be concurrent with other medical or behavioral concerns. So just be aware that we might be treating multiple things with that animal, and the animal might be taking a lot of different medications, and being aware of what medications they're on and what interactions are there is going to be important from the veterinary standpoint. Remember to screen for diseases or screen for other endocrine or physiologic conditions while you're addressing behavior problems. And then either treat or refer early if possible. Some take homes for trainers, those of you who are working with these patients in a training or behavioral capacity. Watch for if you're working with middle-aged dogs or older dogs, watch for behavior changes. Remember that behavior change is one of the first signs of a physical problem. The reason why we take a pet to the vet is that something has changed. And usually there's something behavioral that's changed. So watch them for behavioral changes in middle to older age dogs. Oftentimes, if there's a sudden change or a fairly abrupt change in personality, that suggests that there may be something underlying that's medical. Watch for signs of pain. So while you're watching these dogs, draw on that history of all these many dogs that you've watched before, and think about, do they seem to be favoring? Do they seem to be moving in a way that's odd? And if you're not sure that there's something that's going on, just send maybe a message to their veterinarian saying, these are the things that I saw. Obviously, you're not going to diagnose them, but you might say, I saw that he was favoring his left front leg slightly, or you notice that when he tended to stand up, he tended to push off with the left hind leg. So write the behaviors that you observed, and send that to the primary vet, or send that to the client so they can take it to their vet. And so know when to refer to a veterinarian, and also don't assume it's a training issue. I think a lot of times when we have an adult dog that's starting to have a behavioral concern, I think that sometimes it's assumed that's a behavioral issue, and sometimes it is, but sometimes it's not. So just be aware of that. And then the take home for those of you who have pets in your family, that maybe you're not a professional, you're just a cat and a dog loving person. Remember that aging itself is not a disease. It does predispose for disease, but just because your pet is getting older does not necessarily mean that the fact that they're slowing down is something that's inevitable. So remember that the behavior change is the first sign of a medical problem, and that senior dogs can often be helped. The amount of times that I've had clients come to me and say, I think that he's just slowing down. I just don't feel like he's comfortable. We get him on some pain medication, let's say. And then all of a sudden people are calling me saying, this dog is like he was when he was a puppy. I haven't seen him this active in a long time. So just be aware that senior pets often can be helped, and it's up to you to advocate for your pet and reach out to the veterinarian for that. And I would say especially for senior pets, reach out to your veterinarian first, because there are so many possibilities of medical conditions that could be going on, that I think that's a very important component. So if you are interested in this topic, if you have a senior dog of your own, if you're a trainer interested in information to possibly give to people who might be working with you with senior pets, we do have a video on demand at synergybehavior.com, which is my website. And we have a video on demand tab at the top menu. And if you click on that, one of ours is called Successful Seniors. So that might be of interest to some of you. And that is what I have for you tonight. So I look forward to the questions. I did see some questions coming through, and I hope that that was fun and informative to you. And I hope that those of you who maybe weren't thinking about it, will look at your senior pets in a slightly different light. Thanks so much.
Awesome. That was such great information. And I got a kick out of, we just ran our very first senior dog class. It just finished a couple of weeks ago. So I will be sending that article immediately to the trainer who put that together. It's really
Nice.
exciting.
Yeah, excellent.
What a cool thing. Who knew? Meanwhile, I get so many folks that are like, oh, I can't train my dog. He's old. Like, but you can. It's fun.
You can, and it's really, it's just I think that having I love senior dogs. I love senior dogs. I've had, when I moved here from Georgia, all of my dogs were sort of middle-aged dogs, and so they all grew old with me here. And it was just really, when they get to do things with them that they enjoy, they just light up, you know?
Exactly. Exactly. It doesn't have to be training because they're bad. Training doesn't have to be for bad animals. It's for fun
No,
stuff. There's so many cool things we can do. So,
absolutely.
I really love that. If anybody has any questions, now is the time to put them in the chat. Otherwise, we will abandon you and you will have to think of all of your other things. But you all know now how to contact Dr. Valli. If you need anything and you're in Austin, please let us know. If you're in Austin and you want to bring your senior dog to a class, our next one should be in January. So that'll be
Awesome.
really exciting. It's called Senior Snoots.
Oh, do it, do it.
Gotta love the senior snoots.
That's
Okay,
wonderful.
so somebody
Yeah.
asked,
Mhm.
my 14-year-old has always been incredibly food motivated. In the last year, she seems to be hungrier. Sometimes
Ooh.
I think she doesn't realize how recently she ate. Is that a thing?
Are you talking about a 14? So is it a 14-year-old dog or a 14-year-old cat?
Oh, that is a good question. Doug.
Dog. Okay. So now they seem hungrier, and it can be a thing. So the first thing I would look at is, if you haven't already, I would have your dog checked out by your veterinarian, because there are some medical conditions that can cause an increase in appetite. So I would definitely go ahead and do that. I have had a couple of situations where, from a cognitive perspective, they seem to be hungrier, or they seem to be wanting to go to food more often. So I do think there can be a cognitive component to it for some dogs, a cognitive dysfunction component to it. But the first thing I would look at is making sure that everything is looking good from a physiologic, neurologic, and a physical perspective.
I also wonder if dogs are like humans, where sometimes when I'm anxious, I go back to the fridge a bunch, even though I'm not actually hungry, but I'm anxious and I need something to do.
Yeah,
It seems
sometimes. Oh, go ahead.
Oh
Sorry.
no, they say it seems like she's less patient when I prepare her food. She had a
Mhm.
blood panel done, but I'll check in with the vet.
Yeah, yeah. Great job getting that blood panel done as a good first step. But yeah, sometimes they can get a little bit impatient. I know that one of the changes that I do see is sometimes a little bit of a lack of impulse control as they get older. So that might be a component as well.
She's also almost deaf, so she shouts at me. We say she's generally less tolerant. That's
Oh yeah.
fair.
Yeah.
I like to say sometimes they develop standards, at some point they're like, this is no longer acceptable. I have refined tastes. So awesome. It looks like that is the only question we have on here. So if you have other questions and you're watching this, please reach out to Dr. Valli. Go join a senior dog class if you have one available to you. Remember that your kitties also might be experiencing some of these things. So talk to your vet, talk to a behavior consultant for cats.
Yeah. And I forgot.
And
Oh, I actually forgot to mention that we do have a senior class for cats that we occasionally run. It's like an online one. And we are looking to see about putting some of those videos online also. So
oh, that would be amazing.
there. So
Awesome.
just
Yeah,
keep
keep
on our
keep an
website.
eye on Synergy. They have cool programs. Thank you so much again, Dr. Valli, for being here. We really
Yeah,
appreciate
absolutely.
it, and we'll see you all next time. Have a
Thank
good
you so
night.
much, everyone, for spending the evening with me.
Bye.
Bye.